Abdominoplasty is considered a major operation, and as with any procedure, there are risks involved. And our goal is to optimize your preoperative care to minimize those risks and closely follow you postoperatively to identify anything early. The risks can generally be divided into the short-term and long-term risks. Some of the acute problems post-operatively immediately can include reactions to general anesthesia, early wound infections, early problems with breathing and lungs because we've tightened everything, and so everything gets pushed up and your lungs have less room. And so early physiotherapy and mobilization are key to prevent that. Early things that can also include are things like clots in the legs, particularly if you're not walking quickly. And other things can include post-operative bleeding, which if it's small, your body will usually manage that, but if it's significant, it may mean a return back to the operating theatre. Other things include seromas, where there's excess fluid inside. That's normally a part of your healing process, but if it's too large, your body can't dissolve that by itself, and that can become infected and cause problems further on. In the longer term, some of the things that can occur are poor scarring as the scars mature. So part of our follow-up involves intensive directed at optimizing your scar. There can be some slight asymmetry in the scar position, and there can be some contour regularities, particularly if you've had liposuction. And we watch for these things and use things like the garments and the foam with the lipofoam to help contour and ensure that there's consistent symmetry and results. So those are some of the potential risks and complications that you might have. And obviously there's a recovery period. I don't consider pain as a complication, but it can be quite marked for some patients who have these procedures. And it's very important. I talk to my patients about we're going to have adequate pain relief to address that so that they know that they will be looked after. But most patients do say that this can be quite a painful procedure.